College students of color represent a disparities population based on greater levels of unmet mental health needs relative to white students, according to a study. Cronkite News reporter Rosaura Wardsworth gives a glimpse into what mental health access looks like for college students of color in Arizona.
The series of protests against the killings of unarmed Black people this summer spread across the country. University leaders, such as National Association of Black Journalists President KIARRA SPOTTSVILLE, explain how they are coping.
I feel like a lot of student leaders this past summer within the Cronkite school, and specifically student leaders of color, have felt honestly drained and taking on a lot more than, a normal student signs up for when they go to university.
Student ANIYAH BRAVEBOY is leading the charge on protests in Arizona. She shares how she helps members of the Black African Coalition at ASU manage stress.
The BAC had to make sure we were reaching out to our students during the summer, and we were hosting support circles, reaching out to counseling to identify those counselors of color that could come in our spaces and, really play an active role within our community.
According to a study published in 2013 by the National Institute of Health, approximately 1,100 college students commit suicide every year, and almost 24,000 attempt it. In another study conducted by the National Library of Medicine, they found that treatment use is lower in students of color relative to white students. ERIN from ASU Counseling wants students to know services
are just one click away.
We have worked to ensure that we are as accessible as possible for students, given this kind of historic moment in all of our lives.
On average, one person died by suicide every 6 hours in Arizona in 2018, according to a report by the American Foundation for Suicide Prevention. This ranks the state number 14 nationally, with 1,438 deaths by suicide. Dr. AMINA SIMMONS specializes in racial identity, stress, and trauma within BIPOC communities. As a Black clinician, she says she recognizes the value in holding space.
Sometimes I think of them as my babies. That I can't help it but to give them permission to just feel, right, and have these moments and ask these questions and not know and not have solutions, but to again invite us in to be there with them, to know that they're not alone.
ASU counseling services are available 24 hours, 7 days a week. ASU representatives say they want to make sure students have same-day access to clinicians if needed. Rosaura Wardsworth, Cronkite News.
ASU counseling services have support circles and groups available for students who would like counseling in a group setting.